To begin, make sure that you have adequate lighting. Then do a visual sweep of the entire body. During this bird's eye view, observe the symmetry of the skin. Compare sun-exposed areas to unexposed areas, and note the distribution and extent of any lesions.
Okay, I'm going to examine your skin more closely now, but first I'm going to...
Then inspect and palpate the skin systematically, covering and uncovering each part of the body as needed. During the examination, keep the underlying organs in mind. Also consider the structures within the epidermis, dermis, and hypodermis, or subcutaneous tissue. In each part of the body, notice the characteristics of the skin, including its color, uniformity, thickness, symmetry, and general hygiene. Skin color ranges from light tan to dark brown, with pink or yellow overtones. It should have an overall uniformity. Although you may see sun-darkened areas or darker skin at the elbows and knees, there should be no localized areas of discoloration. Thickness varies from the thinnest on the eyelids to the thickest on the elbows, palms, and soles. The hands and feet may have calluses with thick yellow skin. In general, skin characteristics should be symmetric. For example, if the patient has a vascular flush, it should be pink or red and spread evenly across the cheeks, neck, upper chest, or genital area. The patient should have clean skin with good hygiene, which you can assess best in areas that aren't usually exposed and that are difficult for the patient to check, such as the axillae, buttocks, perineum, and inner upper thighs.
Could you look straight
Many
up?
variations in skin color are
Point your eyes
expected.
up towards the ceiling.
In dark-skinned
Gently going
patients,
to pull down
color
a
is
little
best
bit.
seen in the conjunctiva and sclera, which may appear yellowish-brown or contain brownish pigment. The lips and gums may have a bluish hue that is healthy in dark-skinned patients, but can be mistaken for cyanosis.
May I see your hands, please?
Yes.
And the palms and soles may appear lighter than the rest of the body. Other common variations include striae, or stretch marks, which can occur with pregnancy or weight gain, and freckles, which occur on sun-exposed areas in many healthy patients. In a newborn, the skin commonly may appear ruddy, cyanotic in the hands and feet, or marked with blue-black patches called Mongolian spots. During the examination, also note any odors or lesions, which can be clues to specific problems. If you detect a lesion, record its size, shape, location, configuration, color, including blanching, and texture. Also note any elevation or depression, pedunculation, and exudates. For groups of lesions, assess the distribution pattern too.
I'm going to examine your skin now.
Oh, okay.
Remember that some lesions normally occur, especially in older adults. For example, seborrheic keratoses, which are raised warty lesions, typically affect the face or trunk. Cherry angiomas, which are tiny, round, red or brown papules, often are found on the trunk and extremities. And lentigynes, or age spots, which are irregular gray-brown lesions, usually occur in sun-exposed areas. However, if you detect a mole, assess it thoroughly to determine if it is
You
worrisome.
had this mole long?
About 6 years.
To judge its characteristics, remember the ABCD rule of melanoma. A mole is more likely to be malignant if it has asymmetry in its shape, borders that are irregular, a color that's blue-black or variegated, and a diameter that exceeds 6 millimeters.
Have you noticed any changes in this mole?
I'm not sure. What should it look like?
Well, normally a mole is tan or brown, and it should look like any other mole on your body.
I see.
Well, normally it's round or oval, but it definitely has a border that separates it sharply from the skin around it, like you have here. It should feel like a smooth bump that's flat around the edges. Can you feel that?
Yes.
That's okay. And it should be smaller than 5 millimeters. But that's about the size of a pencil eraser.
Oh.
Overall, it's normal to have between 10 and 40 moles, usually in areas above the waist that get a lot of sun, like your arms, your shoulders, and your back. And so far, everything here looks good.
While inspecting the skin, palpate it too. There should be little perspiration or oiliness, and the surface should be soft, smooth, and even. With the backs of your hands, check the skin temperature, which may range from cool to warm, but should be the same bilaterally. To assess turgor and mobility, gently pinch up the skin on the forearm or sternum and then release it. The skin should move easily and return to place immediately when released.
Okay, I'm going to check your scalp and hair.
Next, inspect and palpate the hair, noting its texture, color, distribution, and quantity. Scalp hair should be shiny, smooth, and resilient. Its texture may be coarse or fine, and curly or straight. Its color may range from light blonde to black to gray. Hair distribution and amount can vary widely. Some types of hair loss, such as male pattern baldness, are normal. Others, such as overall loss on the feet and toes, may indicate a circulatory or other disorder.
Okay, everything looks good so far.
Now examine the nails, which should appear clean and symmetric, and should have smooth edges. Variations in nail shape, length, and opacity are common. But the nail beds should always be pinkish in light-skinned people, and may be pink with pigmented bands in dark-skinned patients. The nail plate should be smooth and flat or slightly convex, with no grooves, depressions, or pits. In older patients, you may see longitudinal ridges and beads, which are normal variations. Now measure the angle of the nail base by placing a ruler across the nail and finger, and checking the angle formed by the proximal nail fold and nail plate. The angle should be 160 degrees. If the angle is 180 degrees or more, the patient has clubbing, which may signal a cardiopulmonary or other disorder. Also examine the proximal and lateral nail folds. You should see no redness, swelling, pus, warts, cysts, or tumors,
Does this cause you any pain?
and palpation should cause no pain. Now palpate the nail plates, which should feel hard and smooth and have a uniform thickness. Gently squeeze each nail between your thumb and index finger. The nail base should feel firm, and the nail should adhere well to the bed. Remember to inspect and palpate the patient's toenails, using the same techniques that you used for the fingernails. By thoroughly inspecting and palpating your patient's skin, hair, and nails, you can learn a lot about his general health and can gain valuable clues to underlying disorders. By teaching him how to examine his skin at home, you can enlist him as a partner who will make your future assessments even more accurate and timely.